Good morning, everybody. My name is Frank Chiskalki, and I'm your VP of Intelligence at the Medical Alley Association. And I so appreciate that you've taken a bit of time out of your day to join us this morning, learn a little bit about your community, hopefully ask us some really good questions, and get more involved in making this the global epicenter of health innovation and care. This is a new virtual event series from the association meant to share information and insights on what's going on in the community. We'll have a couple of my colleagues join me throughout the presentation to share some of their insights. You can use the Q&A or the chat function to post questions. I'd recommend using the Q&A function. It makes it easier for us to keep up on the questions, to keep organized. And if we don't get to your questions or if we can't answer it here, we'll have a record of them and we will follow up after the event. The purpose of today is that there's a lot going on in Medical Alley, and there's a lot of things you may not be aware of, you may be curious about, or maybe you have some insights we could benefit from. So we want to give you better information so you can better enable this place to be the global epicenter of health innovation and care. We're going to talk about 3 topics today. I'm going to give you a little bit of background on what's happening in the startup community. My colleague Alexis is going to talk about what's going on with talent and workforce. And then my colleague Lily will close it out and talk about public policy, especially what's happening on the state level. Before we get started with the insights, I'll give you just a quick snapshot of what's going on in our world and what we're all about for those of you who might not know. The Medical Alley Association is a nonprofit trade group for the healthcare and health technology community in the state of Minnesota, in Medical Alley. Started by Earl Bakken back in 1984, we have a mission and vision today that is very much in line with what Earl tasked us with 36 years ago. Fundamentally, it's to make sure that the work you do can benefit patients around the world, and that this community remains the best place on earth for health innovation and healthcare. And we also want to make sure that the world knows that this is the best place on earth, that it is the global epicenter of health innovation and care, and that the work you do is truly amazing. We are supported in our work by a fantastic group of foundational and sustaining members who provide our key underwriting so we can keep the lights on, so we can deliver great value and be of service to all of you. If your organization is one of these foundational or sustaining members, thank you so much for your support. If you'd like to learn more about what it means to be a foundational or sustaining member, please reach out at any time. We have a wonderful group of leaders that help drive the association forward, including a diverse group of board members led by Jim Rogers from Mayo Clinic and Jody Hubler, an investor and entrepreneur. The board members drive our strategy. They represent you to make sure we stay aligned to the things that are most important to the membership in the Medical Alley community. You might not have known, but there are 15,000 different healthcare organizations in Medical Alley. It is a gigantic industry for the state with 500,000 jobs, 10% of the state's workforce. While every state has a large healthcare industry, no state has what Medical Alley has, which is healthcare delivery, leaders in payment, and leaders in technology that are neighbors, that are friends, that are collaborators and competitors. So with that, I'm going to tell you just very quickly about what's going on in the startup ecosystem. And the short message is it's growing really fast. A couple of trends I'll talk about that we already are the Silicon Valley of healthcare. People just don't know it yet. There's been strong investment across the different stages, and there's a lot of investment in the ecosystem and the infrastructure that's making it even stronger. So the first thing to recognize is that we have this large and growing cohort of companies that are primed for significant activity, to have exits, to have IPOs, to create jobs, to create wealth. These are just a handful of some of the high potential companies in the community, but there are so many more. As these companies mature, it's going to create a wave of activity that will attract new talent, new technology, and new investment, and we want to be prepared. There's been strong investment growing into these and other companies. Quarter one, traditionally one of the stronger quarters, has been relatively consistent for the last 5 years of plus $100 million of just private capital. We've recently started tracking the public markets as well, as there are many companies, especially biotech firms, that use the public markets to raise development capital. When that's added in, Q1 of 2021 was almost $350 million put into startup ventures. In the last 5 years, in total, there's been more than $5 billion that have gone into startups. And because the costs here are so much lower, and many of you are so much more efficient at running your companies, that $5 billion would be like $10 billion going into California. The companies go further on the same amount or on less money than we see in other regions, and that's creating a giant bolus of high impact companies. And in fact, one of the most exciting trends is we're seeing a maturation. More companies that are raising large rounds, indicating they are getting to later stages nearer to commercialization when rapid periods of job growth, wealth creation, and most importantly, patient impact starts to happen. Also of great benefit is that the number of companies raising money has increased. With the return of the angel tax credit for this year, we saw a large increase in the number of truly new and early stage companies that raised money, giving us the sense that we'll continue to have a pipeline of companies that can raise larger rounds later and create more jobs, so we don't end up with a donut hole where a bunch of exits happen and there's no companies behind them to keep it going. Last thing I'll talk about, the infrastructure that's going on. You may be surprised to know that there are nearly 30 different venture funds operating in Medical Alley, investing in healthcare across the stages of development and in biotech, med device, and digital health. Many of these funds did not exist 3 years ago or 5 years ago, and there are many more in development that we expect to see announced soon. There's also a growing number of incubators and accelerators that are helping to seed truly early stage companies. Some of these are private incubators that haven't identified themselves but work with Medical Alley to support their companies. Some are very public programs like G-Beta MedTech or Techstars United Healthcare, and many are connected to our wonderful product development companies who see opportunities to take their expertise and develop their own ventures or develop new ventures in partnership with investors. On top of that, we've seen just in this year a number of high-profile exits that should create new capital to invest in new companies, as well as trained experts and management teams that can go and start new companies. Most exciting has been how many of them have been involving local companies, like Preventus, which spun out of the Mayo Clinic, which was acquired by the Minnesota operations of Boston Scientific, or Zipnosis, which recently was acquired by Bright Health. On top of all of this, we're seeing public investments that have supported the ecosystem, some that are paying off after many years. The Angel Tax Credit Program has brought nearly $175 million to healthcare startups, and the newly created LaunchMN program has put almost $2 million into those companies. We've also seen huge improvements in the work done at the University of Minnesota and Mayo Clinic, where they're translating publicly funded research into new ventures, many of which are based right here in Medical Alley. Medical Alley Association launched back in February Medical Alley Starts, a dedicated set of resources to help your startup companies or to help investors find startup companies. If you're working on a new venture and you need any assistance, please do not hesitate to contact me and we'd be happy to be of service. We know the product works. We've helped many companies for many years and the results speak for themselves. Companies have raised money, found partners, and even been acquired through the support that we provided. And with that, I'll stop my remarks and I'll turn it over to my colleague Alexis to talk a bit about what's going on in the talent and workforce world. Alexis, if you would.
Thank you, Frank. Hello, everyone. My name is Alexis Kohansky. I am the Director of Member Engagement, and I have the pleasure of working with a lot of our HR talent acquisition leaders across Medical Alley. And I'm really excited to share with you just a couple of things about what we're hearing and seeing in regard to workforce trends. So I'm going to go to my first slide. All right, so as we think about some of the trends, I just want to level set here and talk a bit about just overarching what some of the Minnesota workforce trends are. So as a whole. So what we're seeing is that there is expected to be a lot of robust job growth as vaccinations increase. I don't think that that's much of a surprise to a lot of us, but as folks continue to get vaccinated, we're going to continue to see a lot of that job growth. And as that correlates into, as of February, 47% of the jobs lost during the initial weeks of the pandemic have been recovered. And it's not expected to kind of get to that, pre-COVID level until the end of 2021. But we're continuing to see growth as things continue to move forward. And as we're thinking about where we'll see a lot of that growth, a lot of that will be in that face-to-face occupation. So as we think about some of those roles that we can't necessarily do remotely, we're going to see a lot of job growth there. So bringing folks back together face-to-face, as we can see, there's been some changes with CDC guidelines and the way that folks are able to interact now if they're vaccinated. So we'll continue to see a lot of that growth. So next slide, please. So, as I think about giving this kind of intelligence briefing or being able to share this information with all of you, I want to highlight some of the work that our association has done with HR leaders and how we continue to grow and really show how Medical Alley is a place that we would like HR leaders and talent acquisition leaders to engage with our association. So I have had over 70 individual introductory conversations with HR leaders representing all of the different sectors that comprise Medical Alley membership. And our ecosystem. Some of these have led to roundtable private discussions with a lot of these leaders, and some of the topics include talking about hiring talent in the era of COVID-19, the different strategies, return to office strategies, how our member companies are thinking about this, and then also just, putting a spotlight on that biotechnology industry and some of the innovative ways that they've been thinking about filling some of their talent needs. What I'm hearing from a lot of them from a high level is that there is a lot of interest and eagerness to engage with each other on some of these topics. I think, as COVID created some isolation, I think folks found a lot of comfort in being able to connect with other leaders and not just connecting with just traditional HR leaders, but really having the capability to use Medical Alley as a platform to connect with other leaders across different sectors. And I think that that's key because a lot of them kind of have their, within their own sectors, maybe they have folks that they can connect with, but being able to engage with others in different sectors, they're able to talk higher level strategy, understand what others are thinking in some of that in some of those spaces. And that's been extremely valuable. And then we've also started to do a monthly HR kind of leader newsletter. So for all of you who are joining us today, if you have an HR leader that would stand to benefit from being engaged in some of these groups, or there's ways we can push out some of the information, please connect with me, and I would love to connect with them to get to know them better and loop them into some of the engagement opportunities that we have with some of these HR leaders. Next slide, please. All right, so some of my insight is going to center around just high level trends, but I think everyone has return to office on their mind, right? We're all thinking about how we're going to navigate this space moving forward. So I want to share some of the things I'm hearing from our member companies in regards to return to office. So many have used data methods to gather employee perspective on how to return to office. So we've seen a lot of member companies looking to do surveys to kind of gauge where their employees are, whether it be, have they been vaccinated? How do they feel about coming back to the office? Should it be 5 days a week? Should it be 3 days a week? Do some folks want to continue to work remotely? So we've continued to see the utilization of data to better understand where their employees are. And with that, I think what we're hearing is that hybrid work from home and organized in office schedules is really looking like where things will kind of land softly. I think folks are seeing the productivity has been fairly well for, remote working conditions, but also a need to get back in the office and have that in-person collaboration that can't necessarily fully be replaced by virtual settings. And so we've seen a lot of employers really looking to find a hybrid work setting, and that's been one of the more popular thought processes about getting back into the office. And then also just this reimagination of how office space is used. So really thinking, does every employee need an office? Is there a way that we could have some community space or spaces that folks can come in, plug in, do their work, leave for that set day, and just make it more of a workplace that is a bit more in transition for folks that are coming in? And so a lot of interest in tapping into Medical Alley to get connected to different folks that do some office design and looking at different ways they can set up their offices to support hybrid workplaces. We're also hearing that talent is dictating a lot of the remote work policies. For some of our member companies, they're saying that, having that flexibility with remote work is a huge talent edge for a lot of them. And then also I've heard from a couple of member companies that there's been talent that's turned down, really great positions because they didn't feel like the company was more flexible with their remote working policies. So this was an interesting one, and I know it varies by talent and probably by companies, but this is an interesting trend that continues to move forward. And what we're hearing from member companies is kind of figuring out what that sweet spot is in regards to their culture for a company and how they want to think about remote policies and what that means for the talent that they're looking for. In regard to vaccines, it remains a sticky issue, which probably isn't a surprise for a lot of folks. But, the mandating piece, I haven't heard of many employers, coming down saying that they're mandating vaccines, but we have heard a lot of employers thinking of different incentive methods to get employees to get vaccinated, thinking about strategic ways to implement education, rollout campaigns to ensure that employees are knowing as much as they can about the vaccine, offering PTO for folks to recover from getting the vaccine. We've been hearing a lot of that. And I want to continue to emphasize that we are hearing that our Medical Alley member companies in this space and these HR leaders really see Medical Alley as a place that they find immense value in connecting with other HR leaders. And we're going to continue to use our association as a place to connect these leaders and continue to have these important discussions on these topics. We're going to move to the next slide to talk a bit more about just some of the other trends. So what we're seeing too in regards to talent and what I've been hearing from member companies is these companies are really looking at who is their current talent. How can we retain talent? How can we look at the talent that we currently have, look at skill sets? Can we promote within before hiring externally? This has been something where folks are really looking to retain their employees at high levels. So we've heard a lot about those different strategies. I will say I've heard some of this too in some of the companies that have manufacturing line workforce looking to bring some of them in-house as opposed to working with partnered employee placement agencies as well. Some of these looking at these different strategies to look to retain some of these workers, which kind of leads to my next bullet, which talks about some of the high demand for these manufacturing line workers. I think what we're hearing as well is that it's really competitive. The wages as employees are, looking around for the best option. Some of our companies are really struggling to get line manufacturing workers in the door. And they're seeing this also because with COVID, the demand for products kind of took a little bit of a dip, but it came back roaring, right? As in hospital elective procedures came back. There's been a very strong demand for products. And so they're really looking for workforce employees and having some challenges in getting line manufacturing workers in the door. And then we're also hearing DE&I is huge right now. Medical Alley launched our DE&I webpage that highlights our member companies' efforts. And this is an area that employees are interested in, and also our companies are looking to continue to grow in. Next slide, please. And, this we're going to kind of hop back to the manufacturing line workers. So looking at increased competition for talent. So companies kind of fighting over some of these employees are bouncing around, looking at different strategies. And then also some of the positions that we're seeing the most demand and need for across Medical Alley, really a variety of different engineers ranging from software to quality, manufacturing, research and development. We're seeing some sales, project management, and then also some supply chain roles as well. So this is just another plug for you. If you are a part of this presentation, you are a member of Medical Alley Association, please be sure you're using our jobs board to get in front of talent. You can post as many positions as you would like. And please remember to connect your HR leader with me if you think they would stand to benefit from being looped into the ways we've been engaging our HR leaders. So with that, I'm going to hand it over to Lily, and she's going to share some insights on our state policy and advocacy work.
Good morning, everyone, and thank you, Alexis. Again, for those of you I haven't had the pleasure of meeting, my name is Lily Melander. I'm the State Policy and Advocacy Director here at Medical Alley, and I'm going to be giving you an overview of all things state policy. So on Monday, the Minnesota State Legislature wrapped up their legislative session. While it was very quiet and uneventful, much, if not all, of the work is still needed to be done. So they will be going into overtime to balance the state budget to avoid a government shutdown by June 30th. So I'll give you a recap of what happened, what's next. But before I dive into that, I'll give you a high-level overview of how we really determine our legislative priorities, which will give you more context when you see our association's 2021 legislative priorities. I do need to start out by saying that I'm so lucky to be working on a policy team with some really wonderful individuals who monitor both state and federal policy. Our team is really fortunate in that together we have a decade plus years of experience building relationships with legislators and staff. We are fortunate enough to carry those relationships over to Medical Alley, which has laid a really solid foundation for us to build off of as we advocate to advance Medical Alley as a global epicenter of health innovation and care. This is a credible asset generally, but also during a virtual session, it's been extremely helpful having the ability to get a hold of a staffer or legislator, get the inside scoop as to what's going on. As we weren't physically able to be in the Capitol this year and run into one another in the halls, that's really where you kind of gather that intel. So we're in the relationship business, and we have seen how important those connections are this past year, and how those relationships are so critical in gaining support for our legislative priorities. And since we're talking about the priorities, I'll quickly touch on how those are developed. When the legislature is not in session, we're essentially in our off season. So we take the time to hear from our wonderful members. We go out and we learn about what everyone's working on, things that are going well, things that aren't. We see if there are any common themes and trends across the board. We gather all that information, and then we figure out how we can create policies that really fill those gaps, develop policies that really support the innovative work our members are doing. And so we really looked at 4 areas this year. And so Frank, if you'll go to the next slide, I'll touch on those. The first being talent and retention. We know that Minnesota must significantly increase its attraction of talented people and better prepare its existing workforce in order to keep driving healthcare forward in a positive and impactful way. I know Alexis touched on this. And the next being fostering an innovative ecosystem. For Minnesota to maintain its leadership position, Minnesota must continue fostering an environment for innovators. This requires a renewed commitment to supporting entrepreneurs and incubators, ensuring that our state has the necessary tools to capture and retain the growth of organizations that really drive our innovation economy. And I know this really plays into what Frank mentioned and everything around Medical Alley starts. The third being healthcare transformation. Our country is facing significant challenges in healthcare, and to solve them, we must listen, lead, and innovate. And Medical Alley Association has been at the forefront of that, really focusing on policies that will increase access, improve outcomes, and lower costs. And the fourth being health disparities. Disparities in access to care, health outcomes for underserved and rural and minority population. It's long been a significant issue in healthcare, but it's been deepened by the pandemic. So we've been looking at policies that would eliminate those disparities. And Frank, if you'll go to the next slide, I can touch on Medical Alley's priorities for the 2021 legislative session and kind of where they stand now. So the first one that you all are well aware of and heard from us before is funding the Angel Tax Credit Program. We need a robust and stable funding for the Angel Tax Credit Program. I know Frank touched on the points about this, but it's a key piece to continuing to develop our innovative startup ecosystem, as well as Launch Minnesota. These programs help entrepreneurs. Funding them sends a message and signals that from the state that we want innovators to come to Minnesota. We want them to stay. We want them to grow here. And we want to provide them with the tools so that they can thrive. So the Angel Tax Credit Program was included in the governor's budget as well as the House and Senate. Launch Minnesota was supported by the governor and the House budgets. We're also looked at supporting full PPP conformity. We know that this is crucial in accelerating post-pandemic economic recovery for Minnesota's workers and businesses. This was a part of a global deal reached by the governor and legislative leaders at the end of or on Sunday before the legislature adjourned. So this will we will see full PPP conformity in the special session. The next issue area is telehealth. This has been a big one for our association and our members, and we've been working on it for a year and a half now. We put together a telehealth document laying out policy framework for legislators to use as a guide. Medical Alley Association supports telehealth policies that enable the delivery of safe, secure, and innovative and high quality care for that is uninhibited by unnecessary laws and state regulations, and ensuring that patients realize the benefits of the increased access, improved outcomes, reduced cost, enhanced personalization that telehealth provides. Provisions around telehealth were included in both the state and or in both the House and Senate budget proposals. They vary a little bit, but over the next couple of weeks, they'll kind of hash out some of the policy language around that. And then maternal health. This was a big one for us that we had been working on this year, both at a state and federal level. At the state level, we are working and we have supported extending MA postpartum coverage to 12 months. We believe that every woman, regardless of their background or location, should have access to equal maternal health and care services. I know that maternal health was included in both the Senate and House provisions, and over the next couple of weeks, they will be working to negotiate whether it's 6 months or 12 months coverage. And then last is a SciTech internship bill. This is crucial, especially after the year that we've all had, that we need to look for programs that will build Minnesota's STEM workforce. Funding these provisions were included in the House and Senate, and we anticipate them being included in the final agreement. I know I threw a bunch of information at you, and so you may be thinking what happens next, given that the legislature is going into overtime. So Frank, if you want to go to the next slide, we can kind of touch on what June's going to look like for our policy and advocacy team. So the governor and legislative leaders came to an agreement on session budget targets Sunday night, which was crucial in order for any finance committee to pass a bill and really balance our budget. This was great news and is great news, but it came a little too late for the legislature to get their work done on Monday, which is why they're going to go into they need a few extra innings to get their work done. And our team knew that going into session this year, that it was going to be challenging given the virtual nature of session. We knew that it was a budget year, and the state has never before seen a budget attempted to be hashed out virtually, let alone a budget that is the largest surplus in modern history for Minnesota. And so we knew that the work would be slimmed down at the Capitol, and that the bodies will be focusing on a COVID recovery plan and working together to develop a budget that would be signed into law by Governor Dayton, or Governor Walz, excuse me, to avoid the shutdown July 1. Given that it's no surprise the legislature, it's the only divided government in the country, there are a lot of different viewpoints, and we're judging a lot of politics around the priorities. And so with every piece of policy lies the politics. And we've seen this played out when one party's priorities are not included into the other parties' budget proposals. It's really just a chess move. We know that each party tests one another. It's a game. And so the biggest thing to remember is what legislative leaders have stated at the beginning of session, looking at what bills they've really pushed throughout session, monitoring what's been said and going on. because this will give you a better idea of what each party is willing to kind of give up in the end in order to achieve those high level priorities that each of them have. And we've really seen that played out during the global agreement by the legislative leaders. The House is able to get K-12 funding. The Senate was able to hold off any tax increases, and the governor so far has been able to keep his emergency powers and allow both he and the legislature oversight of how the federal COVID money will be spent. While the legislative leaders made strides in the final days of session, there's still plenty of work to do to address specific policy language in the coming weeks. So we anticipate session starting June 14th and wrapping up by June 30th, again, to avoid a shutdown. I know our association will continue to advocate for our legislative priorities. We'll continue to leverage those relationships that we've built at the House with legislative leaders and staff, and continue to form you all along the way. So Frank, if you want to go to the last slide. If any of you have questions or concerns about anything policy related, please don't hesitate to reach out to one of our great team members. We're happy to be in contact with you. And with that, I'll turn things back over to Frank to answer any questions.
Thank you, Lily. That was fantastic. So members, we'll turn it over to you. If you have any questions, please do throw them into the Q&A function. We're here for you. I think what you've heard from all of us is the work we do is based on your input, your ideas, and we're always looking for new ideas and new things to work on your behalf. So please do throw any questions you have into the Q&A function. I saw a few kudos and nice comments in there. Those are also always welcome. All right, and if we don't have any questions, that is a-okay. You can always find us afterward. So I see one coming up. Lily, there's a question for you about, did the Angel tax bill then get final approval, or probably what's the status of that?
Great question. So the Angel tax credit, it's still in negotiations. It was included in the House and Senate's tax omnibus bills. We're lucky that one of the tax chairs is the author of the Angel tax credit bill. And so for us moving forward in the next couple of weeks, we'll be reaching out to all of the tax conferees. We will be asking our members to send emails to all the tax conferees, and we will also be sending a letter to the governor and legislative leaders urging support for the Angel tax credit bill. As of now, it was only funded for 1 year, so we're really pushing for 2 years, given that the last few years that the program has been funded, the account has been depleted under 5 months. So there is a strong need for the program. It's being utilized, and it's obviously a great tool to have to get people to come to Minnesota and stay here and build their companies here.
A follow-up question. We have a question about the SciTech internship program and what's the status of that?
Yes. So again, this bill was included in both the House and Senate jobs bills. And we will be sending a letter supporting this, but we do anticipate it being included in the final agreement, which we'll know more in the coming weeks. On May 28th is when the fiscal spreadsheets are due from each of the chairs. And then June 4th is when policy is due to legislative leaders, and everything has to be agreed to by Governor Walz, Majority Leader Gazelka, and Speaker Hortman. That was part of the agreement that they came to on Sunday. And so again, this is a program that people have supported, and I think that they'll continue to support, but we obviously will be weighing in on that and advocating for it along the way as well.
Oh, fantastic. We have a question about the status of the local biotech community, which has been a huge growth area at the University of Minnesota. Biotech in Medical Alley has been growing rapidly. It still has some challenges around finding management teams, right? We have a great technical community, a great supplier community, but we haven't had a lot of big exits yet that train up the people who know how to grow a new biotech venture. that may be changing with some of the companies that are out there. I'm thinking of like Rebiotics, which was acquired by Ferring Pharmaceuticals. Lee Jones, co-founder and CEO, is being honored today as University of Minnesota Entrepreneur of the Year, which is well-deserved and fantastic. And there are others like the growth at Aldevron in Fargo, Biotechny in Minneapolis and St. Paul, Virad in Rochester, and many others that give a lot of potential for the ecosystem, but we'd really benefit from a big exit that kind of changes the narrative of Medical Alley being a med tech and healthcare state to being truly a healthcare and health innovation state. Great question. Anyone else out there with questions? What I love is once the Minnesotans ask the first question, they usually start rolling in, which is what happened right there. So please, if you have any questions, do ask them or forever hold your peace. All right, well, we're probably winding down then. I want to say thank you to everyone here who joined us this morning. I so appreciate you giving us your time and being members of the association, making our work possible. It's all for you. Anytime if you have questions, you have ideas, you have compliments or complaints, please do track us down and put us to work to make sure this community remains the global epicenter of health innovation and care. Have a great rest of your day.